Hello, and welcome to Riverside's Breast Cancer Awareness Month speaker series. Riverside is pleased to present a new community talk on a different breast cancer topic each Wednesday this month at noon. Breast cancer is the most common cancer among women, second only to skin cancer. While breast cancer impacts women of all races and ethnicities, racial and minority groups are often diagnosed at later stages and face higher rates of death from breast cancer. In today's talk, presented by Dr. Verneeta Williams, a family medicine physician at Riverside Brentwood Family Medical Center and a Riverside Health System Foundation board member, Dr. Williams will share important information about disparities and shares ways together we can address barriers so everyone has the opportunity for early diagnosis and treatment of breast cancer. Dr. Williams?
Thank you so much. I'm excited to talk about an area that we don't commonly hear about except in October, because October is National Breast Cancer Awareness Month. It's a word that we would like to see others talk about throughout the year so that everyone has the opportunity to discover if breast cancer is among you, meaning in your body, in your family, in friend groups when you talk about it, and definitely to attack it and be a survivor of this disease or disease process known as breast cancer. Specifically, when we look at breast cancer across the board, females in general have had a decrease in mortality or death related to having breast cancer. However, when we look at African American populations and other populations, which we'll talk about, there is still a high mortality or death rate related to someone who is diagnosed with breast cancer. We want to kind of look at why and move forward to ways that we can attack that rate and actually preventative measures that help us. So again, African Americans have a 40% higher chance of dying in terms of likelihood from breast cancer. There are reasons for that, some which are modifiable, meaning we can help change that, and others which aren't, which may be genetic in origin. So we're going to look at ways that we can diminish that rate. Specifically, when you look at facts related to African Americans that have breast cancer, as I said, women have breast cancer. Black women, although screening is higher, it still doesn't equate to the fact that 40% of African Americans have a higher mortality than Caucasian women in terms of dying from breast cancer. When you look at diagnosis in terms of ages, African Americans are diagnosed at early ages, however, later stages of breast cancer. And by that, I mean that at the time that they are diagnosed, although they're younger, the stage or the aggressive nature of the cancer has often left just that area of the breast and may have spread to other areas in the body or is more aggressive. And when I use the term aggressive, I mean that the cancer, which is an abnormal cell or tissue in the body, has different factors that cause it not to be as easily treated with chemotherapy or radiation or surgery. It is more aggressive in our bodies. So when we look at the third point, which is triple negative breast cancer, women, and actually African American women, have twice as amount of chance or are diagnosed twice as often with triple negative breast cancer. And what that means is it's a cancer that's really aggressive in terms of spreading and not being kind or nice in terms of the treatments that we offer this type of breast cancer. So again, although we are diagnosed early, African American women that is, it's a later stage of presentation. And if it's triple negative breast cancer, which is a more aggressive, it's a bad actor type of cancer, then that is a cancer that is often found twice as much in the African American population in women. And so when we look at the Hispanic population of women, we find that breast cancer is the leading cause of death in that population. And once again, there are many factors, some possibly genetic, others that are non-genetic, that might be leading to this increased risk of Hispanic women of dying of breast cancer. We do know that English is one of the factors, and it is a barrier actually in the Hispanic population. So when you talk about English speaking Hispanic women versus non-English speaking Hispanic women, there is the likelihood of 27% less screening. So we're talking about screening mammograms in women that don't speak English. So imagine if you are in a community in which English may not be commonplace and more Spanish speaking only, that population, it's been shown, may not and often does not get as much screening in terms of breast cancer than a population that's Hispanic that speaks English. So that's one barrier that we in the medical community can work on, but also you as well can look at and say, maybe that's why screening mammograms aren't spoken about or done or performed a lot within my community. We can't forget about the men. So we need to not leave men out in terms of breast cancer as a disease as well. The thought is that men in families that have a first-degree relative with breast cancer may have some genetic component as to why they developed breast cancer. So I would say to men, in terms of this talk, listen up, because we're not forgetting about you. It's rare, but it happens. Let's kind of move and talk about barriers that we can change, things that can help breast cancer not necessarily be something that we only talk about, as I said before, in October. So we look at barriers that we can change, meaning things that we can do something about. Early detection. As I said earlier, African American women absolutely get screened for breast cancer in large amounts, actually 85% if you look at it, which is actually higher than Caucasian women. However, there needs to be more screening out there. So getting the word out, early screening, or 10 years earlier, if there is someone that's a first-degree relative in your family that was diagnosed with cancer. Let me give you an example. So let's say you're 30 years old and you're saying, I'm waiting till I'm 40 to get screened initially. Well, if you know that your sister was diagnosed with breast cancer when she was 30, then really you're kind of behind the 8 ball. So once again, the rules change if you have a first-degree relative that has breast cancer. Community support, I think, is vital. And that's because we don't live in a bubble. We live with our neighbors. We live and go to church or synagogues. We go to temples. We go to the grocery store. We are on social media. All of these are groups that can help us with reminding us about screening. If there are Spanish speaking only communities, then we can reach out to Spanish interpreters and other people that can help us get screened. So early detection, using the communities to support that is going to be key. And those are areas that we can change and make a difference in. Shared decision making is vital. It's not just me as the medical provider, but it's you that's the person driving the car. I'm a passenger. Other people that get in the car are cancer navigators. We're all in the car of sorts in which you're driving to support you. Lifestyle factors are key. Those are things that we can modify. Getting sleep, getting rest, not being stressed, getting exercise 30 minutes a day for 5 days or in 5-day increments, having the right amount of foods, fiber, vegetables, 5 servings a day. Water is essential. I would then look at the systemic factors, the things that maybe we don't think we have reached. And those are things and areas in which Riverside can help you navigate. When we talk about the unreachable, we often look at the uninsured. We look at people that may not have insurance plans or prepared for things like this. And I would say that the uninsured are not forgotten. And the uninsured absolutely are just as vital as you and I are in terms of recognizing breast cancer early and treating it. Riverside has a program in which any woman can apply or ask about or be a part of without any wonder about whether or not they'll be treated differently or looked at differently. It's called Every Woman's Life. It's a program that Riverside offers in that women can apply and be eligible for. Should there need to be any further testing, diagnostic or otherwise, it's covered in that program. And if you need to apply for Medicaid through that program, that happens. Riverside's foundation also works with transportation sources, making sure that you're linked up to the right and proper sources and resources throughout this process. There are cancer outreach offices that we have, as well as cancer navigators at Riverside. So all of these people serve as a community to help you in terms of finding breast cancer early, dealing with the diagnosis, determining which way to go, and ultimately being a survivor of it. When we look at breast cancer, we can't forget about other cancers. There is cervical cancer, which is also very common, and it's higher actually in the African American population. There's ovarian cancer, which is common and more common and higher in Caucasian populations. So realizing that no one should leave here before their time, cancer is important to detect early. And once again, the foundation works to support people through this process, as well as Riverside as a whole. I wanted to leave with you the fact that there are factors, as I said before, modifiable and unmodifiable or non-modifiable. The modifiable ones are the ones that you have control over. So they're ones that you can change and make better. For instance, alcohol drinking. Do we really need to drink alcohol? Well, it depends on who you ask, but I would say that we have shown alcohol absolutely increases one's chance of having cancer. Thus, if you stop or avoid alcohol drinking or limit alcohol drinking, it will decrease your risk of breast cancer. When you look towards your weight, my weight, you say, yes, your weight. That should be in an ideal range, whatever that is for you, meaning that you have the muscle and skeletal muscle, and you have skeleton and you have less fat, which actually helps with decreasing your risk of breast cancer. So we know that there is a correlation between obesity or being out of the ideal body weight and an increase in cancers in general. Being physically active. Physically Fit is one of the movies that my son liked to watch. That's important, not just for your brain and decreasing stress, but also to decrease your chance of having breast cancer. So now you have another reason to join a gym or get out and walk, park further away from the grocery store, take the stairs instead of the elevator or escalator, because it will decrease your chances of having breast cancer or cancer in general. We can't forget about tobacco smoking. The dentist won't let you forget about it, so I definitely won't. Smoking cigarettes absolutely increases your chance of having cancers. So let's go ahead and diminish that and decrease that. Not smoking cigarettes absolutely decreases your chance of getting cancer. I'd lastly like to look at and talk about someone whose hands I have held throughout this challenge of breast cancer, and that is those hands of my sister. The picture that you see with my dad and me in my Easter dress in 1969 also has a picture of my sister, who was 2 months old at the time. And she didn't know many, many years later, actually when she was 47, that she would have triple negative breast cancer. That was a diagnosis out of the blue. She was able to look back at her family history to find out that we did have a great aunt who had breast cancer, but no one else. She had a breast exam, so she knew of her breast self-awareness, and she was able to then take that information, go through this diagnosis after being screened, and it was a positive screen, have a second opinion, have a cancer team, have a cancer navigator. She went through chemotherapy and then a lumpectomy and then chemotherapy following that, so that October 2015, it was her first breast self-cancer or breast cancer month, but she was not just celebrating it because she was supporting friends, it was her. However, I'm really happy to tell you that March of 2016 saw her breast cancer free. She went on to then have chemotherapy so that at 2017, she could truly say, which is the word under her beautiful picture now at 48, she is a breast cancer survivor. So my hope is that you realize we can modify certain things, and we should modify certain things, not just within the African American community, not just within Hispanic communities, but with everyone, so that next October, we will have a different emphasis. It may not even be breast cancer anymore because those rates have decreased.
Thank you, Dr. Williams, for the important information you shared today. At Riverside, our mission is to care for others as we would care for those we love. It is at the heart of who we are and what we do. To reduce health disparities, ensure accessibility to preventative cancer screenings, and to provide high-quality healthcare that elevates the standard of care for every patient. Riverside invites you to share this information with your friends and family. Together, we can make a difference. I hope everyone enjoyed today's presentation and invite you to a new breast cancer awareness talk each Wednesday this month at noon.